Welcome. You're watching continuing coverage of World Healthcare Congress 2012 in Washington, D.C. I'm pleased to welcome Jay Dunlap to the studio chair today. And Jay, you work with Landacorp. You're the general manager there.
That's correct.
Tell me what Landacorp is.
You bet. We primarily provide technology to bring the different stakeholders of healthcare together so they can collaborate to address what you probably hear a lot at World Healthcare Congress are quality of outcome, people getting healthier, living longer, having better quality of life, lowering costs while doing that, and then especially quality issues to be sure that as we deliver healthcare, everybody's making the right decision based on the data that they have at that time.
Well, people seem to know that that is the goal that people should be reaching for, but what are you doing exactly at Landacorp to support that?
We're a fan of the health plans, especially large complex health plans. They're the ones with the capital budget, with the data especially, and then the IT infrastructure to deliver that data. So Landacorp helps those Blue Cross Blue Shield type organizations of the states to have data, to act upon it intelligently, and then to share that with providers and with members.
Okay, and do you have to provide technology solutions to these big organizations, and what do those platforms look like?
Yeah, we are a technology company, so our flagship product is Care Radius, and it's used within the four walls of the health plan to make those decisions, and then a Care Affiliate is used at the provider's desktop. It's amazing how often people make decisions around healthcare just without the right data.
I see. And what happens when I guess it's not very efficient if you're not using the right tools.
Well, not only is it not efficient, but it's very risky, very dangerous. That if you have somebody with diabetes and they are not taking their medication on a regular basis, often the healthcare provider may not know that, and the health plan would, based on claims history, and they could provide a real-time alert that the next time the patient came in, that they would have that follow-up visit with their doctor.
Right. What other examples can you provide that where this is working today?
You bet. One of our clients, TriWest, Dr. McGuire and I had a presentation here today that they've had a wonderful adoption rate, almost 25% of all of their pre-cert authorizations. So it's when you go into the doctor's office and they swipe that card and say if you're approved or not. For that workflow, 25% of that is at a self-service kiosk by the providers now over the web. And that's provided just a wonderful opportunity for collaboration between TriWest and those doctors.
Are you encouraged by the rate of adoption right now, or do you think we should be going faster?
We should be much further along. But
and why aren't we?
Yeah, I am encouraged. I've been in the business for 16 years at Landacorp, and I would say the last 18 months has been the most collaborative session in healthcare I've ever seen. Right. And why aren't we? Trust is the number one issue. That often the data is presented, and whether I'm the member, the provider, or the health plan, I somehow think it's not at my best interest. And so a real-time alert would go to a member and say, you should exercise more frequently, and you should eat less fatty foods. Someplace the member thinks, well, my doctor just thinks that's good for them somehow. Especially then between the health plan and the doctor.
Sure.
That when the health plan sends data over, the doctor could really benefit from that, but they say, probably you're trying to affect me and have less money. And I think what we're seeing now, and what Landacorp is really an advocate of, we're on the same team. That at the end, we have to have healthcare improve in the United States, and as we share data and act upon that, it will happen.
Any concern that this progress will be derailed by any decision that comes down in June that might not support some of the things that are already going on? No,
I think that there are good and better, and then bad and worse parts of some of the things that are being discussed, but for the most part it comes down to low-hanging fruit. There are things that every stakeholder within healthcare could act upon today if they would simply move to a place that they understand they need data to make good decisions.
All right, very interesting. Thank you so much.
You bet,
Jay.
thank you.
Thanks for stopping
Bye.
by. I'm Mabel Jong, thanks for watching.